So it's my great pleasure to welcome Pallavi Jain, who is the co-founder and managing director of this company called Krsnaa Diagnostics. She has come from India to participate in our event. So I want to give her a big. We are honored, we are flattered, we are very grateful for
Thank you so much.
Yeah.
And I think what you said, like, it is a food digestion time, but Vijay's session was so good that I think the laughter has, kind of taken away the sleep. I hope our session also goes on well, that, we don't see any losing faces here.
Yes.
That's what I hope for.
Yeah. Well, you're absolutely right. That was a very, very stimulating and inspiring session. But your story is also very, very inspiring. And I think especially for the women in this room and the women entrepreneurs who might be watching us online. Have I done something wrong, Jamie? Yeah, okay. Okay. Thank you. So I want to start first with how did you get into a startup? I mean, you've heard about all the different founders we've talked about, all their backgrounds. What was your particular path to going from being whatever you were doing to becoming a co-founder of a company that eventually did an IPO?
Yeah, so I can correlate with what Vijay said, couple of things. When I was hearing him, I could, imagine myself there. One is I never ever planned to become an entrepreneur. Coincidentally, my and Vijay's birth year is same, so same age. However, he was being pestered by his parents when he was 26, wherein I got married at 19. So that's the kind of huge difference. I come from a traditional Marwadi background, wherein we start getting proposals as early as when we are 16, 17, and if you're a little bit more extracurricular and socially more active, you start getting proposals much more earlier. However, my father could drag until I was 19, but then finally 19 I got married, which was a turning point of my life. I always thought I would be a nice traditional Marwadi bahu, being in the house, and being a homemaker, of course. But then, again, going back to what Kunal mentioned, God has beautiful plans for all of us. And he definitely had one plan for me. And I became a businesswoman after my son was born, because my family needed financial help. And with my little bit of skills, what I had, I entered into the business world and I started my own career. Krsnaa has been a 360-degree turn. When I say 360-degree turn, it was a completely kind of a tsunami in my life. I was taking the biggest decision of my life, from being married to a single mother. Also, career difference, I was into a complete glamorous field where I was into event management. My weddings were aired on India TV Good Times, where I had the rich of elite class people coming up to me to organize their wedding events, and I was famous for that. And then coming and starting something new. I met our chairman, Mr. Mutta, in one of these events, and where my management skills were appreciated by him. We sat across a small table, we discussed, we want to do something different. I also relate what Vijay just mentioned is like, your purpose and goal plays a very, very important role on your path forward. So we wanted to give back to the society we belong to. Also for me, individually, I had a huge I can't call it a burden, but of course a responsibility to take care of my child, to take care of myself, and also then get something back home to ensure that I am financially capable. So that's when I met Mr. Mutta, and when we discussed about two industries. One was education in India and one was healthcare. He being a pharmacist by profession and by qualification, he had a little bit of knowledge about how the medical industry works on. Way back in 2010, like end of 2010, Krsnaa was born. That time diagnostic tests were very, very highly priced. Also, like here in US, everything is covered under insurance. In India, we do not have every citizen covered under insurance. You have to buy your insurance. Diagnostic does not become a part of insurance until and unless you are admitted in the hospital. If you're just going for plain diagnostic, it is an out-of-pocket expense. So, which was a huge expense for any middle-class family belonging to India, wherein the salary would not be more than 20,000. And if he has to spend almost 70% of his salary on a diagnostic, he doesn't know what to do for the rest of the month. So there's when we thought about, how we can get the best of quality diagnostics to the masses. Again, our focus has always been to cater to the 70% population and not to the 30% which is well-to-do, which is upper middle class or the high class population, but to the general population, where in India, which comes under the middle class, lower middle class, and of course the below poverty line population, who also deserves to get the best quality diagnosis. So that's how Krsnaa was born, with a very, very humble thought that, how can we get the best quality diagnostic services to masses at the most affordable price.
Can you tell us a little bit about the co-founder's background too?
So Mr. Rajendra Mutta, he's the chairman and founder. It's his brainchild and his vision, because when he was doing pharmacy, and I don't know, I of course interacted with a couple of students here, and there are many in the audience who are from Bombay, and of course they are from Kolhapur. So when the Mumbai-Pune Express Highway was made, there were a lot of accidents, because in India or in Maharashtra, that express highway became like a oh wow, like you can reach Mumbai in such a short span of time, and it was a straight road. Otherwise, previously you had to pass through the ghats and go. So obviously when something good comes, something bad follows, like so people started driving rashly. There were a number of accidents and there were traumas. And then those patients were brought to the hospital where we had the pharmacy stores, and there's when Mr. Mutta saw that if there's an accident, there are a couple of tests which have to be done, or it can involve blood tests, CT scans, MRIs, if it's a brain injury. And as I mentioned earlier, it was not covered under insurance until and unless you are admitted. But even if you're admitted, the cost of diagnostics used to be almost either equivalent to the cost of treatment or sometimes higher than the cost of treatment. And sometimes for a lower middle class family. So one incident I would like to share was, which was a turning point in our journey was, there was a woman whose son met with a fire accident, and he was admitted in the hospital, and many tests were to be done. This lady was a single lady. She had to sell her jewelry, then slowly she had to take loans. Of course, she didn't have anything, so she had to borrow money from the lenders. She had to give away her house, and a time came when, she went and sold her utensils also. So only to make sure that, the son survives. Unfortunately, the son, he could not be saved. When the bill came over, the diagnostic bill was, very, very high, and Mr. Mutta had good relations with the hospitals. So, he went and just requested that, this lady has already lost everything. She's lost her son. Can this be discounted? And the hospital said, listen, this is my business, that's your business, please let's not interfere into it. And if you want to do something, why don't you start something yourself? So that triggered, that was a trigger in his mind, and he had seen, so he's also a rags to riches story, no background of finances in terms of, having loaded money with parents. So it's all, everything started by your own. So that's also the thing what really made us think that why can't a layman, why can't a common man get the best of quality diagnostics? So that's the real crux where we thought about it, and we made sure that we come up with a system, with a solution where we can be available to people.
I'm taking away there are two important reasons why being poor or from the middle class is an advantage as an entrepreneur. The one we heard this morning was it gives you grit, it gives you no exit door. Again, it came up with Vijay as well, and therefore quitting is not an option.
Yeah.
Failure is not an option. But you're also bringing up another different reason why, and that is if you're from that background, you're more likely to know what people in that income class, social class, what are their problems and how can you do something to address
you
it.
can relate to it.
You can relate to it, and you actually get a mission to try to do something about that. And that opens up the possibility of bringing modern services to the neglected segments of the population. So that's another wonderful benefit. Give us we have a video on your company, but before we see that, explain to us what the model was. Or maybe let me go back before that. You said these services cost too much. How much do you charge for your services?
If I have to compare to the US prices, a CT scan on a 128 slice machine, I don't know if you are all aware about the equipment, the way they work, but the highest slice machine currently is the 256, which is very rare, but the 128 slice CT scanner is supposed to be the best in class, also from GE. So there's no compromise at the equipment. So here I think I was just kind of trying to Google and I asked a couple of students. So I understood that the cost of a CT scan here would be anywhere about $2,000.
Does that seem right?
Yeah.
About $2,000? Okay.
Yeah. So here, in India, I do it for $15. Yes. So $15 is what I do, and the cost of blood tests, like a complete blood profile, CBC, I will not even be able to tell you in how many dollars because it will come in cents. If I have to tell in rupees, I charge 100 rupees. So it's less than, like it's maybe $1. And some of the tests, what we do with government is as I told you, it will be in cents.
What about MRIs?
So MRI in Indian rupees, we are charging 2,500 rupees.
$30?
Yes.
Wow. Okay. You're still using the GE machine. It's not
Of
like
course.
you picked something off the street.
No quality compromise.
So let's do the math. How can you take a GE machine that costs how much? $1 million?
Yep.
And if we charge $2,000, how can you give it for $15? That's 1%.
So you do maybe 5 or 10 patients a day. I do 100 patients a day.
You do 100 patients in a 24-hour period?
Yes.
So you're doing 4 every hour. You're doing about 15 minutes on average.
Yes. A CT scan, yes, because a CT scan would take less than about 10 minutes for a patient. Also, what we at Krsnaa have done is, we map our time. We ensure that the time is utilized to its minimum because every case may take different time. Like a brain scan may just take about 5 minutes, but a spine may take about 15-20 minutes. So when we are scheduling our appointments or when we are scheduling our patients, we ensure that all brain scans are taken back to back, so that the protocol set on the equipment can make sure that we optimize the time. Also, when one patient is already in the CT scan machine, 2 patients are ready at the back end, where they're prepared with their uniform, or if they need a contrast medicine, the medicine is given. So there's a lot of planning which takes place. But as I mentioned, it's done in a seamless manner that the patient is at a comfort, yet I'm utilizing the equipment to its maximum, and of course I'm giving services to many.
Yeah, that I can say I did have an opportunity to see when I was in Pune. I'd gone to Pune to give a talk, and Pallavi Jain was in the audience, and we connected after the talk. And she said, all the things you're talking about, I'm actually doing in my business. And so I said, can I visit your site sometime, or maybe on the next visit? And it turns out we had a few hours the next morning. So I had the pleasure of seeing this and also going to one of the hospitals.
That's utilization of time.
The utilization. I know. And I think one of the things which came through in your example, the event management leading to the partnership with Mr. Mutta, is that you never say no to any opportunity, and you work backwards and say, what do I have to do to get it done?
Yeah.
And not, can I do it starting from here, but working backwards, what it will take for me to get it done? And so in that same spirit, she fit our visit in that very, very short, with very, very short notice. But what I noticed when I went to one of the hospitals where you were doing this service is these patients waiting for the next person is already queued up. And therefore there is no downtime, I guess. Maybe now is a good time to see the video, because now you have a sense of what is going on. Although I think it may be good if you could also explain the business model that you use with the hospitals and the public-private partnership.
Yeah.
Then I think it'll be clearer on the video.
So what we are doing different in India is because it's not that Krsnaa is the only player in the diagnostic segment in the country. There are many players, regional ones, and of course, what makes us different is that we are the only national player in the country who is in the PPP segment. PPP segment in India has been very old model in terms of infrastructure, in terms of other sectors. But healthcare, it was a revolution when PPP came up in 2010-11, with one center, wherein it's a partnership with the government. Okay. So when it's PPP, it's public-private partnership. So the public is the government, the private is players like us, and it's a partnership to get something better on the table, wherein our synergies matches, and where the government lacks, we fill that place. Where we want the support, the government supports us. So it's a very healthy kind of association with the government. In India today also, a large population is dependent on government services. Not everybody can afford to go to a private hospital, get private services. So a huge population is still dependent on government. So of course, government infrastructure now is developing a lot, but then way back then when we started, there were hospitals, but the diagnostic equipments were not present, or if there were diagnostic equipments, there was not educated technical manpower to ensure that they're operational, or maybe the government workers used to just come from 9 to 5, and then there was no service available. So they had some minuses, we had some minuses, we put them together and we made plus, we got an infrastructure from the government hospital, so the space is given by the government, the required electricity at a subsidized cost is provided to us till the site. Then what we bring to the table? We bring to the table is the modern infrastructure, the latest equipments, the manpower to run the equipments, and the most important part is making sure the services are available 24/7. So no person has to go back, or because in India, in the rural areas, where we are present, people come from various parts, they travel 1 hour, 1.5 hours to just come to the government hospital. So to ensure that they get the service and they go back with their report is very important. Like in regions like Himachal Pradesh, where we are present. So there are places where there is, ice fall, 6 months in a year, or maybe 4 months in a year. If there's a trauma or if there's an accident, that person used to travel for geographical distance is just 60 kilometers, but it used to take them like about 8 to 9 hours because of the terrain. So now the equipment is in his village. So there he can get his service, plus using the latest technology. We have a cloud-based platform, we have a software, we use teleradiology as a reporting mechanism, where he doesn't have to wait for 2 to 3 days for his report. He gets his report in 2 hours, 3 hours, and he can get his treatment done immediately. So the government is now getting benefit that, a private person is operating in the government premise. The people are getting benefited. Also a large population, the BPL category population, where he gets free services, but he's not getting it at a compromised quality. So it's a win-win situation for both of us.
Okay. Got it. So the hospital gives you space, gives you subsidized electricity, gives you a good location, I assume, because many of the hospitals are already in place in good locations. And there's also a hospital population that you would serve.
Yep.
And so they're right there as a captive
Yeah.
or customer base, if you will. You also cater to people from outside the hospital who walk in or schedule appointments, correct?
Yes, of course.
How many of those are insured? How many would be paying out of pocket? Or are all paying out of pocket?
So unfortunately, as I mentioned, that
They're all paying out of
insurance
pocket.
is not a part of the diagnostics. So they're all paying, but even when they're paying out of their pocket, they're still saving about 70%, because in India also, Krsnaa rates are almost 60 to 70% lower than the private players. So they're still saving a huge amount.
By coming to you.
Yes.
Got it. And you now do this in how many hospitals?
So currently we are present in 15 states, 3 union territories across the
Wow,
country.
okay.
So that's like, and geographically, if you see our footprint, we are at 3,000 locations.
Wow, okay, so you've really scaled up
Yes.
at this point. Okay, let's take a look at the video now. I think it'll be clearer. So remember, when you're watching the video, anything you see of the diagnostics inside a government hospital, Indian government hospital, I don't know if many of you remember, what you imagine and look at what you see in the video.
Health is the greatest gift bestowed upon mankind, and diagnosis plays an important role in maintaining this gift. However, not everyone has access to quality diagnosis, and therefore there has always been a need for a reliable diagnostic player. In a country as vast, diverse and populous as India, it is almost impossible to reach out to every nook and corner of the country and provide quality diagnostics at least cost. To address these challenges, a humble visionary set out on a mission to make a difference in the field of diagnostics with "Let's do good" as its core values, and thus Krsnaa was established in 2011.
Let's do good. A small seed which was sown 12 years back has now turned into a beautiful, huge, large tree, giving its presence and spreading its branches across the country.
What started as 2 radiology centers has now grown to a wide network of more than 3,000 plus diagnostic centers, including 140 plus CT scan centers, 38 plus MRI centers, 240 plus processing labs, 1,200 plus X-ray and teleradiology centers, and 1,300 plus collection centers, conducting over 21 million tests annually, thereby making a difference in lives of people across 15 states and 3 union territories of the country. And the credit for this goes to the company's ultra-modern and robust network of diagnostic centers that works seamlessly round the clock in providing diagnostic tests to the nearest as well as the farthest regions and delivering accurate medical reports of these tests through a team of well-qualified doctors and healthcare professionals in the least possible time.
We have a unique hub which is located at Pune. We have a team of 80 to 90 technologists with varied experience of 5 to 15 years. We are able to touch so many lives and provide services within time. We have a TAT time or turnaround time of 2 hours. So with the help of these dedicated radiologists and technologists, we are able to provide good quality services in good volumes, penetrating to the district and sub-district levels also.
In today's era of services being delivered at doorsteps, Krsnaa's home collection squad is just a call away.
We have medical laboratories across 7 states. These medical laboratories are manned by close to 100 doctors who come from varied fields like pathology, microbiology, biochemistry, analytical chemistry, as well as molecular biology.
When the world was at a standstill, with unprecedented challenges and fear of unknown, Krsnaa once again took over these challenges head-on, leveraging its out-of-box solutions approach. by making the world's first of its kind COVID-19 mobile testing buses and sending it to the containment zones and jumbo COVID centers. Krsnaa Diagnostics is on a mission of reaching out to countries' remotest pin codes to serve every citizen equally and with a personal touch, thereby giving them access to the best diagnostic services at economical prices to ensure every person is delighted by our services.
At Krsnaa Diagnostics, we continue to leverage technology, whether it is the teleradiology setup or latest technologies such as next genome sequencing, through which we focus to continue to provide quality diagnostic services even to the remotest corner of the country at highly disruptive prices.
In spite of the many achievements in a short span of 12 years to its credits and becoming the largest player in PPP diagnostic segment, Krsnaa is working ceaselessly round the clock in maintaining its position as the best service provider in the country and staying true to its call of
We're done.
Okay, well, I want to look at that, talk for a bit about the teleradiology piece of it, because I think what's interesting is you're also harnessing technology and modern technology to bring down your costs. It's not just cheap labor, it's not just high volume,
Yeah.
but also using technology which does multiple things for you. So speak to how that system is set up and how it operates.
Yeah, so our chairman had foreseen this problem. Radiology is one sector in qualification which is scarce across the globe. Like you find very less radiologists, and when we were present, when we were starting to establish our CT scan machines in remote locations of the country, the radiologist would not be wanting to go and settle at such kind of locations. So there's where technology came into picture, where how we can leverage the best of technology and ensure that the radiologist is at his comfort zone, sitting where he wants to be, yet getting the best of image quality, because definitely image quality plays a very important role. So using the technology, the cloud-based platform, he gets all the images to view. He sees them, he reports them, and then the reports are delivered at the specific location from where the report came. So we also, as I said, I always emphasize that Krsnaa has always focused on quality. So the accreditations what are required, we are the only in the country to get an NABH accreditation for our hub, which is one of the highest in the country. All our labs, even if we are in government hospitals, we ensure that we get NABL accredited, so that there's no compromise into the samples or the processing manner what we use. We have a team who lays down the SOPs in a manner, there are strict norms which they have to follow, because we are practically dealing with blood samples, with urine samples, and with human lives. So for us, that is very, very important, that all the results what go out, go through a lot of checks and balances, and then the report is given to the person. So teleradiology has played a very, very important role in the growth. Now, when I say teleradiology focusedly, that a lot of government hospitals in India had analog X-ray machines, but they didn't have doctors, or they didn't have the technology to report them immediately. So maybe, in villages, one doctor used to travel to these multiple clinics, once a week or, once in a fortnight. So the patient, if he's got an X-ray done today, had to wait for the doctor, for about 8 days to make sure what his report is. But with teleradiology now, that same person gets his report in 20 minutes in case of emergency, in 2 hours in the regular time. Imagine I'm present at Kargil, which is a zone in India where there are a lot of terrorism attacks happening. There are soldiers. So if there's an injury to a soldier and he gets his report in 15 minutes, a life is saved. That's exactly what we're trying to bring on the table. That how we can leverage the best of technology, best of quality equipments. Also, instead of people coming to us, we going to the people and ensuring that, okay, we are here to ensure that you get the best of services.
As you look to the future, do you have any other areas in which you would like to do this same kind of activities, or will you just geographically spread and deepen penetration?
We are open to partnerships and spreading our wings, because sky is the limit, we say. However, India itself has a large scope yet. We are still not able to even, we are at the tip of the iceberg, and there's a lot more to do. But when it comes to teleradiology, definitely we are open to collaborations. We are open because Indian doctors are known to be the best across the globe, and we have a team of 250 radiologists, which is like largest in the country. So we, and as I said, we work 24/7. So we can collaborate with anyone, like
Okay. Before we open up to questions, so get ready if you have any questions. Your customer is the government for the part when you're not dealing with the public. Do they pay you?
Of course, they do pay us. So if they didn't pay us, we would not be a public listed company and a profit making company.
So what's the secret to getting paid?
One is
you have a dashboard which you mentioned.
Of course.
Yeah.
So one is ethical practice. We always believe one thing, like, and I can relate to what Vijay said a couple of minutes back, that we don't run behind money. If you do good work, we always believe, our chairman always says that profit is the byproduct of the services you give. It has to come to you. If you're doing a good service, your customers are satisfied. Also, you're doing ethical practice. So, what we think, a lot of people ask this question, very common, that, oh, you're working with Indian government. How is it? Do you get paid? Or, are there any setbacks? No, Indian government will also pay you if you're doing good work, if you're doing a right practice. We took one step ahead as a company, because we thought that why not make everything so transparent that we don't have to run behind the government to get our payments done. The government just clicks a button and gets. So we created a real-time monitoring system, which we called as a dashboard. The government appoints a governance officer, or there are states in India now wherein the CM also has access to the dashboard. So anytime, wherever, whichever part of the country or globally he's traveling, at a click of a button, he knows in his particular state how many patients walked into the government facilities on that particular day, got the services, and were they done within the time. The TAT is very important in India. So turnaround time, what we call is, so that all comes on the dashboard. At the end of the month, the governance officer just has to click a button, check, okay, so many patients were done within TAT, why outside TAT, is there a valid reason to it, or maybe there are cases where we have to call back the patient. So if that is mentioned properly, I don't have to run pillar to post. My payment comes within times. Of course, 90 days is what we expect, because it's a government, the paperwork has to be in place. We're still not very, very highly using digital, because obviously there have been incidences where people have given wrong information. So the government also wants to be a little more vigilant. Sure. So then, but 90 days. And one very, very positive thing about being a partner with Indian government, or with government, is it can be delayed but not denied. The payments come, it can be delayed because obviously every state has its budget. Maybe COVID time, the budgets may have gone high because we had to do a large number of tests. But they are never denied. We may get it a little late, but we get the payments.
You get paid. Okay. There's a question here, please. Mike? Or just ask the question and I can relate. Sonia?
Fascinating presentation, and I work on trade and development, and so my question is, do you see a possibility for this model to be replicated, licensed, right, in a lot of other places that also need healthcare on a large scale and affordable basis, and frankly, the US and Canada too, right?
Of course, it is a scalable model. We just tied up and opened our first international center at Maldives. We've participated in a tender in Ethiopia. So when I say public-private partnership, it's a tendering process. So whichever government will come up with a tender, and if we fall into the technical qualification criteria, we are open to it, and we will be more than happy to expand and give our services. In fact, I was just speaking to Mrs. Latha when I was with her, and we spoke about something, and I've already texted my doctor about it.
Thank you, Pallavi. Very inspirational. And one of the big challenges that we face in a small state like New Hampshire is mental health and preventive early intervention, primary care. So I see the radiology, it's very technical and it's beautiful, and telemedicine can work. What do you think of other fields of medicine that, remote access is a big issue?
No, if I can do it in India, I can do anywhere on the globe, because remote access has always been an issue in India, because the geographical spread of the country is very high. Here, what I see in the last couple of days, this is my first time in US, so when I saw, you have technology in place, you have internet connectivity, you have road connectivity, but maybe there is some lacking which I don't know. But in India, in spite of many challenges, if we've been able to make this model a successful one, with the right channel, with right support, and with right tie-ups, I'm sure this model is scalable in any part of the globe. And as you said, mental health, also the early diagnosis of a lot of things. That's why we've now entered into the genome sequencing, what Yash mentioned in the video, that a lot of the coming population is going through a lot of genetic disorders, and cancer is spreading highly because of lifestyle changes, your eating habits, your sleeping habits. And then will our next generation also go through this? So then why can't we take preventive steps? How can we do that? So it's a vast field where we can definitely work at.
Pallavi, our time is actually already up,
Yeah.
but I do want to get you to share some insights for any women potential entrepreneurs. What was it like? Was it harder? Was it easy? Did somebody help you?
It's never easy for a woman. But I always tell you, in India, when I speak on a Hindi forum, where there is like a lot of about Nari Mukti and Nari this, Nari that, there are a lot of platforms which can. So I always say, what is the spelling of woman? So it's WOMAN. So we have a WO extra with us. So we always have it within us. It's just we need to channelize it in a right manner. I always say we are not in competition with anybody. When we remove that one thing that I'm a woman and how will I be able to do it? No, you can do everything. It's just don't try to prove yourself. Just don't get into a competition with anybody, not even a woman, not even a man, not even anybody. Just do what you are good at. Focus on how you can bring difference on the table. And as I was mentioning earlier to you, that when we started the company and when we had board of directors, so there were nine men and I was the one single woman. Now I have one more independent director, because now I'm a public limited company. That never ever made a difference, because I knew what I'm doing is good. I know what my path is. There have been times where, of course, challenges have been there, where I had to spend a little more time convincing the men in the board that, if we take this path, it will be better. But eventually they knew that, iske ye bol rahi hai, to ye karna hi padega, that kind of thing. So yeah, but the journey has been beautiful. Mr. Mutta has been a great founder. He always trusted in the abilities. We have a good strength of women in our organization. And one thing I always tell is like, if we listen to each and everyone, whether it's a simple technician of the organization, or even if it's a director, and you just take all the pluses from there, leave the minuses, definitely there's nothing what can stop you.
Thank you, Pallavi.
Thank you.
And
Thank you for having me here.
Wish you all the best.
Thank you so much.
Thank you.